that how to stay absolutely healthy. Now coming back to the point that how to stay absolutely healthy and happy in spite of having diabetes, make sure that you keep your values of sugar, cholesterol and blood pressure within normal limit. Fasting sugar 80 to 110, post meal sugar 140 to 180, 3 months average 6 to 6.5, which can be relaxed in comorbid conditions or if you are aging population. The blood pressure around 120 to 30 systolic, 80 diastolic. This is very important. Maintain your weight optimally with BMI falling in range of 19 to 24. Make sure you are not overweight. Thirdly, do regular physical activity of around 30 to 40 minutes brisk squats, gymming or swimming. That keeps you going. And सबसे important is that you need to have perfect diet control. Take all the meals within the framework of calories prescribed to you. Take adequate amount of carbohydrate, protein and fat as advised to you. In case if you want to indulge in some sweets or something food of your choice, get the supplementation and get the replacement of the proper food in the terms of calories. We call it food replacement therapy, knowing that what are the calorie contents of the food which is of your choice. For example, a diabetic patient may eat ice cream, but he need to be wise enough to reduce another calories, although it is a food with a high glycemic index. But once a while you can indulge, once a while you can diverge to the food of your choice, but try to maintain the overall calories like that. If some patient has been advised insulin, please make sure you follow your doctor's advice. It is for your betterment of organs, etc. If you follow these simple protocols and the periodical evaluation and consultation, probably there is no reason you cannot stay happy, healthy and fit. Truly speaking, diabetic patient stays fit and healthy much more than a normal patient because they turn out to be more disciplined over the period of time. That's all my good wishes to a diabetic patient. Maintain your all the numbers, maintain the discipline, maintain the physical activity, do eat nutritive food and the fruits, be in touch with your doctors, go for periodical evaluation, and no one can check you for being absolutely happy and healthy. Good luck, all the best.
Wait for now.
Very interesting. I got a question. What is your opinion on remdesivir for COVID treatment? Okay, let's diverge from our basic topic of diabetes to the COVID. Remdesivir is one of the very good drug. It is being used in US, not allowed or permitted by DGCI in India to be used, but there is a trial by WHO known as Solidarity trial in which 4 drugs are being used, that is hydroxychloroquine, antiviral loperamide and ritonavir and remdesivir. The results of remdesivir so far are good in literature. In the trials also, we being the one of the pioneer institute for this solidity trial. In India, it is likely to be available in the first week of July on commercial basis. So far, literature goes in favor that yes, it is a good antiviral effective drug, but how far it is from a specific antiviral drug for COVID, we'll have to see over the period of time. But till today, it is one of the effective drugs which can be thought of tackling the COVID-19. Once someone has asked me a question about remdesivir in COVID, I must tell you what are the precautions a diabetic should take during this COVID crisis, because one need to be very careful, especially big number of our population is an elderly population. So my strong advice to all the diabetic patient during this COVID time that please restrict your activity outdoors, stay at home, protect yourself. If you are 60 plus, I would strongly say that you need to protect yourself. You need to stop going out for next 3 to 4 months. You need to maintain a social distance from others. You should step out of the house only after putting the mask, and you should do the frequent hand washing and sanitizing, which is very important. Another thing, diabetic patients, since they are not going out and staying at home only, so they need to do some yoga or some exercises at home to keep themselves fit. Try to regulate your diet, try to monitor your sugar at home so that you maintain your sugar at home, which is very important. There's another question asked to me, what will be your advice using prophylactic options like arsenic, album 30 for high risk patient? In fact, probably I'm answering all the questions related to COVID-19. This is a homeopathic drug. Homeopaths do claim, but I am not in position to comment anything about a different pathy. I also hear that it has some relevance, but it will be nice and prudent if you can ask this to some homeopath question, which is very important. Sir, what benefits a diabetic patient get from exercise? Absolutely a fantastic question. Kapil, if you start throughout the journey of diabetes, exercise has a role from day one of diagnosis of diabetes till very advanced stage. Initially, if you exercise, you may control your sugar without any medication. You will reduce your weight, you will control your blood pressure, so it is highly effective. If you use your exercise, continue during your diabetic management, your control will be very good. You require lesser drugs. If you continue your exercise during diabetic journey, probably you may require insulin very late and you may respond to the oral drugs much better. If you continue exercising, you have lesser complications like peripheral neuropathy or peripheral vascular disease or cardiac complications. So exercise is the most important tool for overall fitness of the diabetic patient. Next question comes, sir, will favipiravir helps to treat the COVID? It is one of the new drugs recently released. It's an oral antiviral drug by Glenmark, and we need to see the results over the period of time, how this drug is safe, how effectively it is helping the containment of the COVID-19 program. There is another question by Madhyan. Diabetic patient having knee issue, which exercise will be helpful for glycemic control? Any person who has a knee issue, they should do the quadricep exercises, because it is very important for diabetic patient to have a healthy knee, otherwise it will restrict his mobility and sugar will shoot up. So diabetic patient should do quadricep exercises. They can learn from their orthopedic colleague or a diabetologist. And diabetic patient, if they have knee issue, they can always go for swimming, which is a very good exercise for diabetes as well as people with the knee problem, which is very important. I think I don't find any more questions. I'll be happy to take any more questions if they're there. I'll be very happy to advise. One important thing I like to tell you, that any diabetic patient who sees that his requirement of oral drugs or the insulin is going down, that is not a reason to feel happy. You need to be very careful about your kidney profile and get your urea and creatinine done. Sometime involvement of kidney in diabetic patient or early kidney damage may lead to the falling of blood sugar, so need to be careful about it.